Hello, my name is Stacia, and for my topic analysis, I was given social anxiety disorder. So the symptoms include, the big one is the fear and anxiety of social situations, such as speaking, performing in front of others, even speaking in a group, or situations where there could be embarrassment or judgment. Um, Again, that can be meeting new people. Sometimes it's even as severe as placing orders at a restaurant, making phone calls. So individuals will refrain from putting themselves into social situations especially when it involves people they don't know. They could show symptoms of blushing, sweating, trembling. In young children, this could maybe crying and tantruming, seeking out people that they are comfortable with. So the prevalence that was an interesting one. So social anxiety disorder is the most prevalent anxiety disorder after specific phobias. Um, it varies from country to country, with the highest rates in the Western country. It's at 7 to 13%. But when considering that, it's important to also look at the social standards and expectations. So certain cultures might not be as inclined to seek out the help if they're not feeling like they have to, or it might not be noticed as much because the things that we look at in terms of what makes us social creatures might not be the same in other cultures. So that is one thing to think about when it's comparing country to country. When it comes to like gender, it tends to occur more in females. However, there isn't when I was doing the research, I didn't find a lot that specifically looked at that. But when they looked at it in terms of even like severe, like the one study that focused on socio-demographics, it tended to be more white females between the ages of 30 and 34, with some college or higher at higher levels of occurrence. Social anxiety disorder typically develops in children and adolescents between the ages of 10 and 20. And it will continue into adulthood. And if it is untreated or kind of ignored, it can develop into other disorders as well. So you can see some comorbidity. So social anxiety disorder will impact individuals, not only physical symptoms such as increased heart rate, sweatiness, dizziness, muscle tension, shortness of breath, but they'll avoid social situations, which hinders them from forming relationships with others. And when it's young, it's friendships and even like family relationships. And then as they get older, it can impact their seeking out like partner relationships. So SAD not only impacts the individuals, but also them around them. So if you think about a family dynamic and you have somebody with social anxiety disorder, what you do will be impacted by that individual, as they might not want to do those things. Like, nope, we don't want to go to the zoo because I've never been there before. I don't know what the park's going to be like. I don't know this. They're not going to want to go to a spot where people might ask them questions that they don't know. So it's going to impact that. And that's where that falls in. So when it came to finding the different interventions and the levels of evidence, so a big part of it was pharmacological. And with that said, a lot of them were antidepressants, SSRIs, SNRIs. But in terms of the evidence level, like I couldn't find a lot on the psychotherapies. And while they're out there, it seemed like there was lack of evidence. And I think we'll get to that. But a lot of medications, antidepressants, SSRIs, here's some more that continue, just the level C ones. There was a lot that were lacking evidence. Like, yeah, we do them. This could be a new one. Maybe we'll look at this. So one of the interventions I would like to look at is the virtual reality exposure therapy. So being exposed to different things is a technique that is used in CBT itself. So it's exposing the person to the different situations. However, it's more role playing, pictures, using your imagination. All right, pretend you're in this situation and you feel this. So virtual reality is where individuals are exposed to situations that will trigger symptoms, but you're in a controlled environment. And so, and that can be done with computer simulations or even using virtual headsets. That's a new thing. But so they're immersed in the experience, but they're in a safe place. So there's that lack of fear, like you are there, but you're not there. So that is one aspect of it that I think is really great. So this and it can, so the cost comes in because you have to get trained for it, you have to buy the equipment. However, once it's there and the training is done, this allows for customization for individuals. So you can set it up and then you can just replay that same scenario until they become more comfortable and become more accustomed to it. So it's not, you're not relying on, hey, remember that last time we talked about this and you felt this way? Like it's a played out scenario that they can just step back into and just keep going until there's comfortability built in. In terms of the evidence that's out there, there is promise. However, when it comes to like focused on social anxiety disorder, those can be lacking. I think a lot of it was more on PTSD, which it has shown great results with, even like generalized anxiety disorder. But, and then in terms of like RCTs, like there is an increase in them, but there's still not as many to be considered a higher level of evidence. And it would be used in conjunction with other things. So with CBT, possibly pharmacological, it's not a one or done thing. Like it's in conjunction with other things. I think it's a great thing because it allows for the experience to happen, but knowing that they're not there. The other one that I would like to expand more on and I would like to see more on is acceptance and commitment therapy. So that's it's based on behavior principles with borrowed strategies from CBT and mindfulness. The focus is on the moment and not the future. So it focuses on acceptance of unpleasant events or thoughts or emotions without trying to control them. And then committing to the new and unknown experiences and events and making them become meaningful. So if they're part of the commitment part is clarifying what's important to you and then committing to it. Like, oh, it's really important for me to go out and do these things. Well, then you have to do it. And accepting it is allowing it to happen without trying to control it. Don't fight it. So ACT doesn't look to modify the symptoms or behavior. It works to help the individual experience them, like with openness, so it kind of builds on with the exposure therapy. So ACT uses diffusion techniques to help individuals see anxious thoughts just as they are and not reality. So again, kind of being in the moment, like, yeah, I'm thinking this, but that's all it is. It's a thought. Again, when it comes to the success, it's there. And it is like, again, it's in conjunction with CBT and maybe with medications and group therapies. But it's there, but they've been more experimental pilot studies, but there's been success, but there needs to be bigger sample sizes and follow-up to make sure that the results are sticking. So and again, should be incorporated with CBT. And it even borrows spots from CBT and mindfulness, which is a newer one, but has great parts of it. And so I think this is a great way for individuals to embrace their emotion rather than trying to escape it. So right now, in terms of social anxiety disorder, which seems crazy to me because it's so prevalent, like it's such a big thing. It does affect people. But right now, like pharmacology seems to be the go-to treatment. Like, oh, feeling anxious, take this pill. Oh, feeling this way, take this pill. Oh, maybe talk to this person, maybe do this. And while this may reduce some of the symptoms, it doesn't address the underlying cause. And CBT is often used, but not everyone sees results. So an individual might do pharmacology and CBT and still have symptoms or reoccurrences. So there needs to be more options. There needs to be a wider array. So with that being said, in order for it to become evidence-based, we are going to need to do more studies, bigger sample sizes, randomized control trials, follow-ups. There's even something to be said to like these alternative ones that are coming to fruition, like mindfulness and even meditation and things like that, and just overall wellness, to really look at the cause. So there needs to be more evidence, and I think that that is something that will happen in the future. Thank you.